Hi, everyone. Thank you for joining us today for our third Global Engagement online series. My name is Marco Sanchez, and I'm the Youth Engagement and Advocacy Coordinator for UNA USA, calling from my kitchen in Washington, D.C. We're super excited to have you all here today for our third Geo Session, which is, as you know, our Global Engagement online series, as we'll talk about America's approach to COVID-19 and the role of WHO. Kathryn Kross will be moderating today's discussion, and I'll introduce her in a little bit, but please note that today's session will be recorded and you'll have an option to ask questions to our fine set of panelists that we have with us today. But without further ado, Kathryn, take it away.
Thanks so much, Marco, and welcome to all of you. And here, our third installment of UNA USA's Global Engagement Online Series, or GEOS as we call it, which connects you to experts and perspectives regarding the United Nations. I'm the Executive Director of Communications at the Better World Campaign and at the UN Foundation. And UNA USA is part of that big family of organizations that work together for the benefit of all. In my role, I've had the pleasure of seeing the difference that UN agencies make for people all over the world. And I've also seen the importance of US leadership at the UN and how Americans like you have been among the most loyal and trusted advocates for the United Nations. And we thank you for that. The value of the UN and WHO, I think, has never been more important than it is at this moment, or never been more obvious in the midst of this pandemic. The WHO, and many of you might know this, but WHO is coordinating research trials in 100 countries, a scale that's unprecedented and really unmatched by any other organization. No doubt you've seen Dr. Tedros in his weekly briefings sharing WHO's information with the world and offering evidence-based policy recommendations. So today what we plan on doing is discussing with three colleagues to understand the approach to COVID-19, the role of WHO. There'll be Jordie Hannum, who is the Executive Director of the Better World Campaign, Mike Beard, who's the Executive Director of UN Foundation Advocacy in Global Health, and Lisa Peña, Director of Policy, Budget, and Appropriations at Interaction. So to read their full bios, please click on the link indicated in the chat box. And we hope to hear more from you in the question and answer segment. So we're going to talk a little bit, and then we'll open up the bottom half of the program to your questions. So Jordie, I want to begin with you. We've been reading about a bunch of different stimulus packages that have been signed into law, and two of them include some funding for international affairs. Can you make sense of these stimulus packages and how they affect the global response to COVID-19?
Yes, I can, and welcome everybody. And now let me say at the outset that I generally like to start things on a positive note. Today's Earth Day, it's the 50th anniversary, and I just saw that this year is on track to be the Earth's warmest on record. So I'm a little gloomy today, but then I look outside and I see the trees we've just planted with our extra time, and I feel a little more hopeful. But to answer the question, right, there's been 4 rescue packages that have passed Congress or are set to pass with yesterday's announcement of another $480 billion in small business, hospital aid, testing capacity, which is likely to be signed by the president shortly. So as you said, 2 of those 4 bills have funding for international affairs. Now, to put it all in perspective, of the almost $3 trillion in spending in these rescue supplemental bills, give or take, there's been $2.37 billion in emergency funding for the global response. This is money for the State Department and U.S. Agency for International Development. That's about 0.08% of the total, 0.08. So for a global pandemic, which has spread to more than 180 countries, where 70% of the world remains unprepared to prevent, detect, and respond to a public health emergency, that is unfortunate, to say the least. So we need to do more, and we'll talk about that later. But for now, let's talk about what's inside these bills for the international response. So of the 2.3 billion, and you have a slide there so you can see it, but this is how it breaks down. So there's about 600 million for diplomatic programs. When we say that, we mean to maintain consular operations, evacuating personnel. There's 435 million for global health programs. And here, while there was no specific resources for the UN, some of these funds in this account could be transferred to international organizations like the World Health Organization, and we'll get to that more in a moment. There's 560 million for international disaster assistance, 350 million for migration and refugee assistance. This is obviously for the most vulnerable populations. And funds here could be transferred to the UN Refugee Agency or UNICEF. There's 250 million in a kind of general economic support fund. And finally, 90 million for the Peace Corps, which is actually for evacuating the personnel that have been there. But let me stop there and actually turn to Lisa, who at Interaction, kind of in her day job, has to kind of look at the larger picture for the overall accounts. I don't know, Lisa, if there's anything you wanted to add, and just in terms of what's in the supplementals for the international affairs.
Thank you, Mike. Thank you, Jordie. I appreciate the opportunity to speak today. I would just add that the International Disaster Assistance account could also be provided to international organizations. A lot of the accounts that were chosen here were chosen because of their flexibility, to give optimal flexibility both to state and aid to use the money in the most efficient and effective way possible. So if you looked at them and thought, why these? It's because their underlying legal authorities are the most efficient and effective.
Great, thank you.
That's helpful. Now, the question that everybody's probably wondering is how do these supplemental flows fit with what we've been hearing on the news? Because we've been hearing the president talk about defunding WHO. So you have the supplementals, but what is he talking about when it comes to defunding? Talk a little bit, and this is to anybody, but give us a sense of what that means and what the impact is.
Well, I can just offer quickly to answer, and then I'd turn it over to my colleague Mike Beard, who spends a lot of time focusing on global health issues and WHO. But just in general, when we talk about defunding WHO, so each year and for the past 10 years, there's been kind of between kind of $400 and $500 million that has gone to the WHO. About a little over 100 million of that is in assessed contributions. That's contributions that member states are required to pay, and that's based on a formula. And then voluntary contributions, and these are contributions countries choose to pay. And the U.S. has always been a robust supporter of the WHO because of the many different things the WHO has done that we have deemed in our interest. So when we talk about defunding, it is a significant amount of contributions, and we're talking about both assessed and voluntary. But Mike, I don't know if you wanted to add more there.
Yeah, Jordie, and thank you all for joining. The turnout here is spectacular to hear three people in Washington talk about sometimes fairly dry issues. But I want to stress something that the Director General has talked about in his press conferences. Is like behind all of these numbers, behind all of these budget numbers and others, there are people there, and these are programs that actually get to helping people, not just institutions. So in terms of the freeze that the president has announced, there is, like Jordie said, approximately 500 million. It was about 440 million last year in funds that go to the WHO. But it's because who the WHO is why they go to the WHO. For programs like polio, the U.S. government has long been a leader in ending polio, and the Global Polio Eradication Initiative is actually based inside the WHO, and so our funds that go to WHO are leveraged with that of countries from all over the world, and they fund programs in places that the U.S. cannot be in. So we know that the main places where polio still remains is Pakistan, Afghanistan, and Nigeria. And Nigeria, I believe, certified recently that they are, again, 3 years without a transmission. But the U.S., through public-private partnerships, through bipartisan congressional support, has long sought to end polio. And the main way that we get funds to the polio programs is through WHO. Now, so those funds are, in all intents and purposes, frozen right now. The other thing that we are monitoring right now, and we could talk more about this in a little bit, is within these supplementals, those funds that Jordie talked about. In February of this year, about $20 million was awarded to the WHO for COVID response. And there was some hope that we could get more funds to the WHO for COVID response, because as you all probably know, the WHO is leading the global response to COVID. They are the only organization capable of having the reach, technical capacity, and just they can operate in places all over the world. So we were hopeful that the WHO would continue to receive COVID funds so that we could act effectively get at this pandemic.
And maybe just in terms of COVID, just one other thing to add about the importance of WHO and the challenges. It only takes 36 hours for a pathogen to spread around the world. So we're all in this together. So we may be in isolation as individuals, but we should not act in isolation as countries. And if you just think about kind of the plight of some of the developing nations right there. So if you consider one of the most critical pieces of medical equipment used in treatment is a ventilator. So the US has 160,000 ventilators. Sierra Leone has 13, South Sudan has 4. Or if you consider beds and intensive care units, the US has approximately 34 ICU beds per 100,000 people. That's the highest number in the world. In the developing world, countries like India, Sri Lanka, Malawi, that number drops to around 2 ICU beds per 100,000. So we must help these countries, reduce the number of people who need ventilators and ICU beds. And if ever there was an example of an ounce of prevention being worth a pound of cure, this is it. And the WHO has been central to this effort. During February, at a time when the US was only able to ship 4,000 tests, the WHO helped ship 1.4 million. In early February, only 2 countries in sub-Saharan Africa had the ability to test for COVID. Since then, WHO has helped the region massively scale up testing, and now more than 40 countries can test for the virus. WHO has also sent essential personal protective equipment to dozens and dozens of countries in the region. So these efforts are vital for the well-being of those in other nations, but also to prevent blowback in our country. And so when we talk about completely defunding, that really could dangerously undermine WHO's critical outreach and then harm us as well.
Thanks for that, Jordie. Yeah, it strikes me that very few organizations or institutions are kind of positioned to do, kind of the massive coordination and, and have the global reach that WHO does. Can you, any of our panelists just talk a little bit about what that means in terms of coordination, how other UN agencies are working with WHO to get those supplies, to fly this the PPEs into all these countries?
Well, maybe I should start off with talking about the reach, and this is Mike again, into just how the WHO responds to an outbreak like this. The WHO has 193 member states, I believe. Maybe it's 189 member states because they have less than the General Assembly. But the WHO works with all member states through what's called international health regulations, and their requirements about how to monitor disease outbreaks and to report on these sorts of outbreaks. And so what the WHO has the reach to do that no other bilateral government is to get into countries and see what's actually happening. And they must do that with the acceptance of the country itself. So I believe it was December 31st, the Chinese government sent a message to the WHO saying, we have an outbreak of an unknown origin, a pneumatic disease in the Wuhan province. And WHO then immediately sent a message on January 1st to the Centers for Disease Control, as well as other countries around the world, appraising them of that outbreak. Then they were actually able to go into China in both late January and then again in February to see what types of actions that the Chinese government has taken. And in fact, during the February mission to China, the WHO actually took two members from the U.S. government, one from NIH and one from CDC, to take a look at what the response was like in both Wuhan and surrounding provinces. Not only that, but through WHO's work and its sort of the political work, they were able to, the Chinese government then gave the genetic sequencing of the disease, which then actually advanced the WHO's ability to start finding a vaccine, working on the Solidarity trial, and we could talk more about this, where 100 countries have started to come together to try to advance a vaccine. No other organization has the technical capacity to be able to take on that sort of work, of everything from going in, seeing what's going on. They are operating, I've been having conversations with many members from the WHO who are helping even developed countries like Spain and Italy with their outbreaks and how they are managing the outbreaks. So the WHO is working around the world on trying to manage this outbreak, trying to get it under control, and trying to raise that alarm with countries around the world that we need to also focus on least developed countries that have these health systems that are endangered. And I think Jordie could talk even more about the way in which the WHO is working across the UN, because the UN has some really incredible ways that it works as a one UN.
Yeah, I mean, we've over the past couple of weeks, over the past couple of days, there's been a real focus on WHO, but this is, it's often said, but if the UN didn't exist, we'd have to invent it. And right now I can't think of a time where it's been more true. I mean, when you look at the breadth of the UN's work across the health, humanitarian, and development sectors, it's just remarkable. So, each week we kind of put together a document that just provides highlights of what the UN is doing. And I'll I'll just give a couple examples right now, but just I think 2 days ago, the World Food Program, which has been doing a huge amount in the World Food Program, it's the largest humanitarian organization on the globe, but the World Food Program established an air hub in Ethiopia to distribute vital medical supplies across Africa on behalf of the larger humanitarian community. A team of 25 WFP aviation and logistics staff are at the airport around the clock to manage the 24-hour operation. You have UNICEF, which is providing vital work in terms of educating kids around the world. You have UNHCR, and when you just think about what this disease could mean in vulnerable settings, I mean, 70 million displaced right now. That's the largest on record. They're doing huge amounts to try to protect these incredibly vulnerable populations. But it's really across the spectrum. I mean, we saw the other day that UNESCO is providing free radio ads in dozens of languages that can be used by any radio station around the world to try to kind of just provide basic information on what individuals are doing, and also to stop the harm kind of caused by the kind of so-called infodemic accompanying the virus. So there's literally kind of dozens and dozens of examples which we can share. But this really is been something where the UN has shown kind of why it exists.
The old can't find the unmute button. I'd like to turn back to Lisa and the funding again, just for a moment. Lisa, how do you see things? What are the challenges that we see, ahead when it comes to getting, resources to, continue to fund a global response? The million-dollar question.
Thank you for that, Kathryn. And thank you everyone for joining us this afternoon. I guess you could break that up into two parts, really. We've been talking about the WHO, and there's significant challenges with that. That's so purely political that you can't really get your head around it. I think in general, if you wanted to think about this, and foreign affairs or foreign ops funding does include the bilateral, so bilateral assistance through the State Department and USAID, and at some level through CDC, it's a different bill. And then the WHO, which comes in, but my colleagues will correct me, I don't believe there's a line item for WHO, unless it's maybe in the report, and I think even if it's in the report, which is the accompanying materials, it's a carve out like 2 years ago for WHO for Palestine. Like you don't actually even see a line item for the WHO. Although you do for UNICEF and some of the other UN entities. So as Jordie explained, there's been some money. It's not near enough, and everyone knows it's not near enough. But the problem that we have is that in the United States, we elect people, and they represent Americans, and they feel that they represent Americans. So breaking through on international funding is always an issue. And it's especially an issue now because everyone is focused on the domestic response because people are sick and the economics domestically are in real trouble. It doesn't mean we don't have supporters on the international front. We have plenty, but their influence is going to be limited because, again, everyone is focused on domestic problems because there's not enough money and the economy is cratering. So that's the first concern we would have. The second concern we have is just money. In January, the deficit, which is the difference between how much money comes into the United States government versus how much is spent, was $1 trillion. It is now $4 trillion. So that's not even 5 months. The Committee for a Responsible Budget, their debt projection is that by 2023, our debt will exceed economic output. So that will beat any projection since the years after the Second World War. So that's pretty scary. So if you have another bill after the last four, which we will, let's just be clear, So we've already spent $4 trillion to fight the coronavirus. There's a $1.3 trillion bill coming up, and there are a series of bills, and those are the appropriations bills for FY 2021. So 4 plus 1.3 is 5.3 trillion. And they're going to have to spend more and more and more and more. So there's a real price tag problem now. So people might remember that not too few years ago, we had deficit hawks who wanted to just cut and cut and cut. I mean, they also wanted to raise, they also wanted to cut the tax expenditures, but that's another story. So we have two really big issues, which is international affairs is not a priority. If we're going to spend money, it's going to be on the domestic, and people are beginning to get scared about spending money. There's a side process problem with people don't want to vote on big packages anymore unless they're in DC, and coming to DC is scary because you have to travel. So the next bill will probably be in May. I anticipate we will see substantial investment in foreign assistance here and substantial investment in the domestic economy. It'll be about immediate stabilization. There'll probably be bills after that. If we don't have bills after that, you could see an attachment of so this is kind of esoteric, but this is what we call emergency spending. It's off budget. It's still taxpayer money, so you don't have to worry about it. But you could see emergency stabilization or emergency money put on the next appropriations bill too. So you'll see another bill that'll be immediate stabilization. You'll likely see another bill after that where people think about how do we deal with the tail end of this pandemic, and how do we deal with the pandemic when it comes back? Because if it like wanes in the fall or it stays in the fall and it comes back in the spring, how do we want a health system that's resilient to that? How do we want global in the international sphere? How are we going to strengthen these global health security issues? So I think that's that. On the foreign ops issue, there was money in the first supplemental, as Jordie described, and money in the third supplemental. It was very hard for us to get money in the third supplemental. And one of the reasons was because they hadn't spent any money in the first supplemental, and because as a matter of just process, bilateral spending, so money spent by USAID and state, moves very, very slowly. So they have a lot of money sitting around. And so if you're somebody in Congress who's controlling controlling the purse, so to speak, you don't want to spend more money. It's like you have money, so why spend money? So that could be a problem. Now, the UN entities don't have that problem. WHO doesn't seem to have that problem. The Global Fund doesn't have that problem. And so, as Mike was kind of discussing, if we can get over or past the WHO problem, you could see a more willingness to put in money in the multilateral sets here, the international organizations. People have expressed, I've had people on both sides of the aisle, both chambers say, happy to put money in the Global Fund, happy to put money in some of these multilaterals. A little more hesitant on the bilateral side. Some of these problems, there's a lot of bureaucratic problems in moving money around and moving money through the bilateral system. And then just talking to people who work as grantees with USAID and state. People can't move, right? Borders are closed. Once borders open, if you can't work in a safe manner, if you don't have PPE to work, you can't work. Can you purchase equipment and supplies? Are they available for purchase? So again, an edge that the UN systems usually have and Global Fund will have over some of the smaller bilateral programs. And then are sovereign governments, are they ready? Have they designated their needs and what they're ready to get ready? And so there's just a lot of pressures that need to be sorted out before, if you're Senator Graham or Chairwoman Lowy and you want to go to bat and say, I want billions of dollars for this, it's like, is there the absorption capacity internationally to absorb it now or later? And if it's too late, will we have missed the political window? So I hope I articulated that well enough. But I think the thing is, like, my message to everyone would be, we can't turn away from this, right? And we can't turn away from the world. It doesn't stop at our borders. Diseases don't stop at our borders. None of the problems stop at our borders. So we have to encourage our colleagues to continue to pay attention. And I think there'll be more bills, and I think there'll be more money. But happy to answer any questions.
Just a quick follow-up to that. I hear you on all the challenges that are out there, and but I wonder if there is a moment where you can actually, say, it's not just the right thing to do, it's the smart thing to do, because as you said, a disease anywhere is a disease everywhere. And do you think that logic might be persuasive in this case?
I think it is. I know, and I kind of answered the question in a way that was about challenges. Yes, I think it is persuasive. I think we've gotten to the point where the vast majority of people in Congress understand that. The issue is going to be how much, right? It's not whether it happens, because it will happen. It's just how much will they put in the bill, and will it be enough? And so I think there's a significant risk of losing development gains that we've already accomplished, of not being able to restore a decent global health security system to weather the next pandemic, and things like that. And that's, I think, a challenge in the United States as well. We don't like to prepare for things, we like to react to things. We don't want to invest in something. We just, it's like congressmen, I did infrastructure for a long time. Congressmen like to cut ribbons on bridges. They don't want to pay the ongoing maintenance and repair on the bridge. And I think that's kind of what we're seeing here, right? The system failed. They don't want to pay to restore the system and think how it works well. It's just like, oh, well, can we put a Band-Aid on it and keep going? I think that's going to be the problem.
Well, and can I add just quickly on this point too? One of the big things that we're likely to see over the next 6 to 18 months is actually a spike in preventable deaths that we had been funding quite with some enthusiasm for some years, and we are definitely afraid of what the next World Malaria Report will look like, because there's not enough PPE around the world, personal protective equipment around the world, and a lot of health workers and doctors are unwilling to go out and help people right now because everybody is scared. We're likely to see, we are the richest country in the world, and if you look across Europe, they have some of the most advanced health systems in the world, and we're seeing huge numbers of deaths in very advanced societies. I can only imagine what the numbers are going to look like when if we don't meet this challenge of trying to stand up the health systems in some of the least developed countries, because it will absolutely devastate those health systems in particular, and that's going to mean long term that there are going to be huge. The challenge of getting back to where we were on December 30th, 2019, is going to be monumental, and that's something that I don't think that we are we've talked about it a little through Lisa and Interaction and some of the other global health coalition spaces, but it's a little bit on the scary side to see what is going to happen at the back end of this, and what sort of work that we're going to have to do as advocacy organizations, as grassroots, to be able to rebuild our country and countries around the world in a manner that will protect against the next outbreak, the next pandemic.
Yeah, and if I could just piggyback onto that, I mean, the executive branch occasionally considers and is considering now to what level personal protection equipment is going to be available outside of the United States and how much our partners can purchase, whether they can go to the international market and buy it, or whether the United States is going to preemptively own it all. And again, it gets back to whether interaction members, USAID employees can actually access the appropriate equipment to perform their jobs. And if they can't, then what of the beneficiaries they're supposed to serve? And then to Mike's point, what of all the TB, the malaria, all the global health programs, education programs? What happens?
Thanks, Lisa. I know we've got a lot of audience questions coming up. So thank you to all the panelists rather, don't go away, lots more to come. And I'm gonna hand off to Marco, who's going to be coordinating the kind of the questions. So keep your questions coming in whatever way Marco tells you.
Thanks, Kathryn. And like I said in the beginning, we're gonna have the opportunity to answer a few questions. I'm unsure if we're gonna be able to answer all of them, just given timing, but we wanna make sure that we answer as many as we can. We have lots of great questions indicated in our chat box, but if you'd like, you could also raise your hand, and my colleague DeAnthony will lower your hand and call on you if you'd like to ask a question over the phone. But I'm gonna address a question that we got from Robin Green, and this is, I guess, to all of you. Has there been discussion regarding mandatory protocols that must be followed by countries once outbreak information is shared by WHO?
Well, am I off mute? Yeah, I am off mute. Good. This is Mike. And I am not the expert on this, and so you'll have to forgive me, but the international health regulations do kind of set the framework for reporting of health of outbreaks of diseases, as well as how to react to them. The WHO provides guidelines to countries about how what sort of reaction has to be, or what sort of reaction would be mandated. The WHO is a technical organization. It is not a governing or a governing organization, so they can't actually mandate any country to do anything, but they can put in place they can advise countries on best practices, as well as how they can how like the technical guidance they would need to actually stop or slow down or in any way affect the outbreak in pandemics. So the international health regulations, those were put in place in 2005. You saw actually a big revamp of them following the Ebola outbreaks of the 2013, 14, 15, 16, the West Africa outbreak, and how countries report on their on certain outbreaks. I know that underlying that question, though, there is the question on transparency, and I think that is something that we, as a global society, need to deal with, especially in light of outbreaks like this, and the ways in which the WHO or other organizations could actually ring the alarm on these sorts of outbreaks. WHO does not have intelligence capacities. It is only capable of reporting what countries report to them. So making sure that countries are in good stead and are reporting their these sorts of outbreaks is left up to the countries, mostly because, like I said, the WHO it can provide technical guidance. It does not have intelligence capacities. But yeah, we do know that in late December, like right around the same time that the WHO was reporting, or China was reporting to the WHO about the outbreak, that Taiwan reported on the outbreak. And that's another question that I think was put forward by Robin is the question of Taiwan and how the question that question could be answered. And I would point to you some of the fact check pieces that the Better World campaign has put together about the way in which Taiwan is what its official relationship with the UN, with the WHO is, how it reports to the WHO. There's a lot of information on the Better World campaign website that we could share with you that can go in depth on the issues of Taiwan and its reporting. What we know for a fact is Taiwan reported on news reports that there was an outbreak in Wuhan, and the WHO immediately, or within I think 24 hours or 48 hours of that, had already spoken with the CDC about this. So the alarm raising was it went fairly quickly.
And maybe just to underscore that point, two things. One, yes, we have. I see a lot of questions about China and kind of who knew what when and WHO. So one, yes, we have lots of resources on our website to kind of explain information, but just in terms of WHO and the information that they shared, and also the collaboration with the US, because this is certainly one of the arguments the Trump administration said, just kind of that WHO was not sharing information and was not telling the US. There was a number of articles this weekend which showed how closely US officials were working with WHO, senior officials, experts, CDC, National Institutes of Health, which have always worked closely with WHO, and were, in this case, dozens of individuals who were aware of what was happening in China, in close conversations with WHO. That's important. And then if you just look at the timeline, and we have this, but on January 1st, a day after China disclosed the virus, WHO sent out advisories to kind of public health leaders around the world. On January 10th, WHO issued a package of guidance to countries on how to detect, test, and manage COVID cases. WHO scientists first arrived into Wuhan on January 20th. January 22nd, WHO convened an emergency meeting. This was at the same time that our own administration was kind of saying we have it under control. On January 23rd, WHO warned of a 4% death rate, human-to-human transition. And on January 30th, WHO declared it an international health emergency and urged countries to take aggressive action. So there's just all sorts of examples of WHO highlighting the enormity and severity of this crisis.
So it looks like we have a hand raised from Herb Burstock. I'm going to lower your hand and unmute you, and then you can ask your question.
Yeah, thanks very, very much. Excellent descriptions and information you've given us, all four of you. And it's great to have two of the three GEOS meetings so well attended and focusing on this. The question is, what can we do, Jordie and everybody else, as a UNA in our advocacy work? Can we mount a campaign, or are you going to lead us in mounting a campaign, for example, to approach members of Congress when the next billions of dollars are allotted to make a special earmarking for WHO and UNICEF and UNHCR and these other agencies, Jordie, that you mentioned? Or what can we do to lend our voices? I think there are a couple other people who've asked questions, including a high school student on the call. So we've got about 250 people. We'd like to really make an impact. Thanks.
Yeah, well, thanks for the question, and good. You're stealing my closing here. I was going to end with a call to the ramparts, but absolutely, there's much we can do, and the time is right now. So at at the beginning, kind of Lisa and I have talked about kind of the challenges we're facing with the bills that have passed, and there's been an understandable focus on the domestic side. But right now, Congress is working on a 5th rescue package. This one is supposed to include more funding for international affairs, and we've certainly been pushing it. And so all of us, and I'll go into this, but all of us need to be kind of reaching out to policymakers and making clear the important work of the WHO, other UN partners, and NGOs in the field. I mean, we need to advocate for WHO, for the UN, and we'll provide those resources, but also just to support our key colleagues at the State Department and USAID who are doing vital work. And just to kind of put it in perspective, I mean, we are not going to be asking for the moon and stars here. We're not even kind of asking for 1% of what's been spent, which is, depending on how you do it, but several, so say it's 3 trillion of just kind of the most recent bills, 1% of that would be 30 billion. Right now, we, Interaction, and others are asking for just half of that, basically 0.5% of what's been spent, which works out to about 12 to $15 billion. So all of us have to fight for 0.5%. I mean, we need bumper stickers, we need hats, got to say fight for 0.5, but we have to make clear that one, there is a constituency out there, there is a chorus of people who want these bills to focus just a little bit more resources on the international affairs side. And then for the reasons that we've talked about, an ounce of prevention is worth more than a pound of cure, that if we don't do it, it's going to blow back, how quickly this can come around, and how vital the work of WHO is in helping those countries who don't have the resources, don't have the ventilators, don't have the ICU beds to prepare. So on our end, and we already sent out a email, which hopefully you all got, saying, please send in a letter to Congress today. If you haven't done it, please do it, saying that you support the UN, you support WHO. So we need those letters, those calls to be going in. Please, reach out to your networks just on one, kind of supporting the international affairs budget, and then the work of the UN. So, we've just started that. We'll be reaching out in coming days with advocacy leads to kind of arm them with the information, and just reading some of the questions in the chat box. It's clear that we haven't gotten enough information out. We're almost daily providing kind of updates on what the UN is doing, what the WHO, but clearly we need to do more so people are kind of aware of its vital work. So we'll be providing more of that. But right now we have in the coming weeks, I mean, Lisa talked about the challenges, and they're real, and there's already, blowback on the size of these, but regardless, it looks like that there will be a follow-up rescue supplemental appropriations bill, which is likely coming in the coming weeks. And so we need to be reaching out right now.
If I can just follow that, we know they're working on it.
Yeah.
We've talked to them. There are a lot of people who they're really supportive of us doing a big ask, but what they want is for us to help justify very large numbers. And they need political backing. A lot of people want to kind of go out on a limb because they understand the need, but they need the political support too. So they need to hear from grassroots. They need to hear from organizations like ours to say, like, yep, we think the need is X many billion, and you could spend it here, you could spend it here, you could spend it here. And oh, by the way, actually the need is 10 times that or 100 times that. So this is not in any way just chasing windmills or pointing at windmills.
Great, thank you. So it looks like we have another hand raised from Dr. Tita Banks, our National Council Chair. So I'm going to lower your hand and unmute you. Tita, sorry, we can't hear you. Give me 1 second.
Okay, got you. Okay, I wanted to thank everyone for participating, those who are listeners, but especially to our panelists. As we're talking about reaching out, I think maybe part of our advocacy could also be that we make a 30-second to 1 minute YouTube with all of these different organizations speaking, like the three that we have on the panel today. And I think, Lisa, something as passionate as your appeal would be just magnificent to be on that. I know we can't pay for advertising, but we may be able to do it as a YouTube clip and then have that shared. And that can be part of our advocacy and sending to our congressional people and sending to all of our chapters and our sister organizations.
I think it's a great idea, especially if we had, I could see what my colleagues at Interaction think, because especially if we had implementing organizations and things like that. I don't know, Jordie?
Yeah, no, and this is Mike too. I know that the Global Health Council has also the Global Health Council helped to administer a sign-on letter where over 1,000 organizations and individuals have signed on in support of the WHO. And so there's with UNA and the Better World Campaign are both co-signers of this open letter. And so there are a lot of organizations and a lot of people out there that are raising their hand in support of WHO.
Great. I'm going to take another question that we have in the chat. Again, for everyone that's on this panel, to what extent has the US's image transformed or changed to the rest of the world post cutting funding to WHO? And this question is from Yash Patel.
Well,
I have heard that some countries have, when we saw cuts in funding to other UN agencies, we saw other countries sometimes step up to fill the void. You saw it in UNRWA, and Jordie can talk more to that. You saw it at UNFPA when we cut $32.5 million to UNFPA. You did see other countries try to step up and fill the void, and it's a huge void that the U.S. has filled. I have seen reports that countries like Finland have pledged more money to WHO, which we are very supportive of seeing additional funds leverage. We are hopeful, and we hope that we are hopeful that the administration's freeze. We've seen reports that it's 60 days, although I saw a report today saying it could be a 90-day freeze while they look into they review the WHO's work. But our hope is that at the end of that 60 or 90 days that the U.S. unfreezes those funds and we get the polio money out there. That's we have breakdowns of all of the funds that are out there, but the polio money, the TB money, the money that would be going towards emergencies that currently are not. As we were on the call, I got an email from a staffer at WHO that was kind of giving me a breakdown of what the U.S. has contributed to the COVID response currently, and it is at $30 million right now, and they were negotiating for far more money to help WHO tackle this response. So our hope is that the U.S. does continue to fund the WHO, but it will take the effort of our grassroots here on the phone and around the country to tell our elected representatives that they support multilateralism, that they support international organizations, they support the WHO. But around the world, I don't want to get too far out in front of my skis, but have seen some shows of support for Dr. Tedros from people like the President of France and
well, yeah, I mean, I would say on that, I mean, there were strong, not some, I mean, there were strong shows of support from countries around the globe for WHO and the work of WHO, you know, from kind of each region. I would also say Here in the US, I mean, Mike mentioned this letter, which is going to go out, which got just a huge amount of support. But if you just look at WHO, I mean, in the past few days, you've had the American Medical Association, Chamber of Commerce, and Heritage Foundation, which is very conservative, all talk about how misguided the cut is. So it's not too often those groups and many, many, many others are on the same page and have talked about the importance of WHO. So we have actually been surprised by just the breadth of support for WHO's work. Now we need to keep up that drumbeat. And I think an important point to make, because there's been a real kind of focus on China and influence, and over the past few months, we have been talking about this. Our executive director of the organization testified to Congress on this in November, Peter Yo, just that, yes, there has been more influence of China. There has not been a takeover of China at the UN. The US still has incredible sway, but there has been more influence. And the reason there's been more influence in 2020 is because, and we haven't been talking about this in past years, is because of the policies that this administration has put forward in terms of major funding cuts, major delays, and walking away from key organizations. And that has allowed China to increase its influence. So to counter that, we should not defund, we should not double down on a strategy that failed, but we should do what has worked in the past so clearly, which is invest in the UN, fully fund, be at the table, absolutely should be calling for reforms, but we should be there and be funding, not walk away.
Thanks, everyone. And just to reiterate, we will be sending you all resources that were talked about. There are plenty available on our website as well as the Better World Campaign website, but we want to ensure that we are equipping you with the knowledge and resources necessary to understand the reality that we're living in right now and how you can take action. I also want to point out that we do have upcoming Geo Sessions taking place on April 29th on the life and livelihood during COVID-19. We'll be having several other UN organizations participate in that, including the ILO and the UN Human Rights Office. And then on May 6th, we'll be hosting another Geo session entitled Breaking the Silence on Sexual Orientation and Gender Identity During COVID-19. Lots of great sessions coming up, so we hope you will all join these sessions. And again, we'll be sending you registration links to register for these upcoming events that we have coming up.
Sir, how to get a registration link?
We will send you a link with the email you provided. And I also want to reiterate just the point that I think was the underlying theme of this whole session, was that without the needed support that the WHO and the UN need right now, they cannot complete the important work that is needed to solve this COVID-19 pandemic. Therefore, I want to encourage you all to take action by texting the word pandemic to the number 738-674 to send that message to your members of Congress right now, to urge them to oppose the decision to halt funds to the WHO and to support full funding for the UN and for its global health programs, including the work of WHO. So again, the word is pandemic and the number is 738-674. I also want to encourage you, if you are not a UNA USA member, to sign up to be a UNA USA member. You can text the word membership to the same number to get signed up and to be included in our national network and in our movement to advocate for the UN here in the US. But on that note, thanks again to everyone for joining us today. Like I said, we'll be sure to send you all of these resources that will hopefully guide you in the right direction, but please stay safe and we'll see you next time. Thanks.
Thank you.